Good morning. It's a great pleasure. It's an honor to be part of this first forum, and congratulations to the National Health Insurance Institute. Congratulations to Robert Llolio for taking this initiative to highlight the unparalleled in-house expertise that social health insurance has. It is important, and I think throughout the day on the program you will hear many examples of how social insurances actually innovate themselves in-house. Thank you very much for the invitation, Honorable Minister. Very nice to see you again. It is a pleasure to be here with you today to discuss a bit about the European landscape. My name is Yannis Natsis. I'm based in Brussels. I've been living in Belgium for 15 years now. Originally, I come from Greece, and I have the honor and the privilege of serving as the director of the European Social Insurance Platform. What is ESIP? And actually, we celebrate our 30 years. ESIP has been around for 30 years. It is the alliance of social security institutions, covering all branches of social security. So not only health, but also pensions, family benefits, unemployment benefits, all the things that we as Europeans are used to, and I hope that we will still keep enjoying for many more years to come. Because I come here today to Slovenia in times of difficult challenges that social security systems, social protection systems, our publicly funded welfare systems, solidarity-based, right, are facing similar challenges, be it here in Slovenia or in other countries. The challenges are more or less the same. What differs usually are the resources, the capacity, the expertise. But what we do with ESIP, and that brings me to a bit of our identity, we have 46 national social security institutions, like ZZZS, as our members in 19 EU member states and Switzerland. And we work with thematic committees. We work, as I said, not only on healthcare, but also on pensions, on family benefits, unemployment benefits, and we are in Brussels. Therefore, by being in Brussels, we are there because we want to discuss with the European Commission, with the European Parliament, with parliamentarians coming from all around Europe, because if we are not around the table, we will be on the menu. And what I mean by this is that, especially nowadays, we need to be there to shape the discussions that are happening. So the presence, we need to be in the room when the discussions are taking off. The minister knows very well what can be achieved and what cannot be achieved on the European level. The gentleman you see in the middle is an important policymaker. He is the current Hungarian commissioner responsible for health. Actually, Robert Llolio was in Brussels on Monday afternoon, 2 days ago. We had the honor to have a closed-door discussion. As I said, you need to be around the table, otherwise you're going to be on the menu, with the health commissioner to discuss with other CEOs, with other director generals of national health insurance funds, the challenges that we see from our perspective and what our views as social health insurances are. And for him, as the commissioner who has quite a lot of power in his hands, to listen to us, especially in the field of medicines policies, in the field of pharmaceuticals. So we had a very nice exchange with him, very open, very honest. So at the same time, you know, we have our internal collaboration with the experts coming from our members, like ZZZS. You have a lot of expertise in-house. You have all your experts. We bring all these national social security experts together, but we are also, thanks to the leadership of, for instance, ZZZS under Robert Llolio, we also reach out to the European policymakers. And this is another bold step of translating our expertise, your expertise, the members' expertise of ESIP, into policy asks towards the European legislation on relevant fields of social protection and healthcare. And we are in Brussels because we have to try to, anticipate, try to foresee what is coming our way. Because otherwise, if we wake up too late, it's too late to shape the developments. We have written there, as an example, in May 2025, We managed to get the support of many of our CEOs coming from many different members across the European Union from our constituency to also send a letter to Ursula von der Leyen explaining that we were worried about certain elements happening in European policies. This is another example where we try, we don't always succeed, but we try to be proactive. We try to articulate in a timely and effective manner the views of your national, for instance, in this case, social health insurance. And I want to really invite you to, and this is why it's wonderful that you're having this event today, and I hope that this will be the first of many fora to come. It is important to highlight, because we have, as social insurances, we have all this expertise. And I can assure you, the European Commission, for instance, you think it's too far. Actually, they care. They are coming and they're asking us, what do you think of X, Y, Z? Because they know that social security institutions know what's happening on the ground. They know what's the reality and how, oftentimes a piece of law, piece of legislation, how does it really translate and when it is implemented? So just to tell you that there is a real need. Actually, on Monday afternoon, we met with the European Health Commissioner. He spent almost 2 hours with us. And it was good that Slovenia was in the room because there was France in the room, there was Germany in the room, there was Belgium in the room, there was Austria in the room. So it is very, very important that we also have Slovenia in the room and we have the voice of the country in the room for such a strategic meeting. I don't need to explain it to you, you understand it already. And yesterday we had a very big event, a public event. So, we operate behind the scenes, but also in front of the scenes, on stage. We had a big public event where exactly showcasing what our views are. So the early warning, we do our best. We don't always succeed. Why? Because, you might think that, this guy from Brussels is too far, the European Union is too far. You're wrong. Brussels is usually, and the minister knows it much better than I do, Brussels is usually the testing ground. It is usually, even in healthcare, which is a national competence, let alone pensions, for instance, this is national competence. But Brussels is the place where a lot of ideas, policies, strategies are presented and tested for the first time. And then they are turned into European legislation. European legislation means that then oftentimes this European legislation becomes national obligations for all of you to implement. So once again, we need to be there. For instance, it is good that we had Slovenia in the room on Monday with Robert Llonio talking to the commissioner. The challenges, I believe the minister already referred to and alluded to. Ladies and gentlemen, I don't want to be dramatic at the start of the event, but perhaps, we are witnessing a bit, the clouds are amassing of this perfect storm. Why? Because we're all getting older, we live longer, we have huge demographic challenges. More or less, the picture is the same across the European Union. It means we see the data. As I said, the social security institutions have a lot of data, have a lot of expertise in-house, higher chronic disease and long-term care demands that are going to increase, the shrinking workforce. At ESIP, as I told you, we don't only focus on health, but we also cover the employment policies. You see what is happening in the world of work. There are new types of work, new types of working, and those affect how much money goes into the social systems. And that is a big problem. The narrowing social contribution base, which is the revenue for our, as I said, publicly funded welfare systems. The solutions, prevention, long-term care, healthy aging, healthy workforce, these are not simple slogans. There is a lot of substance in them. Another issue which is quite important for us, and why is it important for us? Because at the European level, at the level of European legislation, a lot of things are set, which is the question of the unaffordable pharma prices for medicines. We presented over the past 2 days in Brussels with Director General Lollo data that shows that across from Germany to France to Slovenia that we have a problem with the prices getting higher and higher. And you will tell me, okay, we have money. No, actually we don't have money because look at, for instance, the economies of France and Germany, the two biggest economies, right? We are in an economic crisis in Europe. Look at the data coming out of these two countries. So we are asking for better evidence at launch of new medicines. I'm not going to go into the details to bore you with them. We're asking for much healthier and stronger competition within pharmaceuticals. And of course, right now I want to give you a little bit of a snapshot of the debate in Brussels. I think it is similar also here in Ljubljana. You know, in Brussels, we constantly, on a daily basis, we hear that what matters is to make Europe great again, in a way. What does this mean? And I mean it in a serious way, that we need to strengthen the competitiveness of Europe, we need to re-industrialize Europe, we need to strengthen the strategic autonomy of Europe, and I think we can all agree with these things. Nobody is against them. The Mario Draghi report, if you have not read it, I encourage you to read it. It's a very interesting report written by the former Prime Minister and European Central Bank Governor of the Prime Minister of Italy, Mario Draghi, and ECB President, on the competitiveness of Europe. This is the new Bible, literally. This is the new religion in Brussels. This is the roadmap which is being followed. So everything, even what we're talking here today, is looked at through the prism of the Bible of Mario Draghi, in a way, that we have to focus on these elements. And then that brings me to elements that I already referred to regarding the world of work, but also, and I think digitalization was mentioned by the minister, and I know that social security institutions are investing a lot in digitalizing our services. There is the big question of artificial intelligence. How can we use it as social insurances? Is it beneficial? What is the risk? How we have to be very cautious. I think we are all in favor of it, but we have to be very cautious not to get it wrong. And of course, the changing world of work, but also the challenges that we face as social health insurances, for instance, with challenge that we see across all systems, absenteeism from work. And here I want to refer to a best practice that is coming from you, from Slovenia, from ZZZS. And this is something that we want to promote also within the European Social Insurance Platform. How do we tackle the issue of absenteeism? Because I can assure you, this is also the Belgians are struggling with it, the Germans are struggling with it. So it's not only, as I said, the systems are, there are differences, national specificities, but the challenges are similar. So there I want to congratulate Slovenia and your institution because we want to learn from you also. This is a best practice that can be promoted because, you know, not every system has to reinvent the wheel. Social security systems can learn from each other. And this is what we are doing within ESIP. And to promote this and to foster this mutual learning from each other and pulling, especially nowadays in this time of the scarcity of resources, pooling resources and pooling expertise is the way forward. We cannot afford not to work together. What else? Did I forget anything? Well, the new market realities, labor market realities, and of course, this touches upon the core of the future of the social protection systems in Europe. How do we finance them in the future? Especially, I will tell you recently, let me just check my time. Recently, I was in Paris at the OECD. The OECD, you know, has a much broader than EU membership, and they convened all the national delegations to discuss one issue. They brought together officials from health ministries, social ministries, and finance ministries. And what was the topic of this meeting? The topic of this meeting was very straightforward. We need to save money because we see that we're going to have to shift money away from health and social protection to other areas. Probably you can think of another area which is actually now getting a lot of attention, and that is defense and security. Where is this money going to come from? How are we going to finance and at the same time keep our social security systems afloat? So the financing of the welfare systems, not only the health insurance, but more broadly, is a key issue that everyone is looking at right now. And that brings me maybe to the bigger question, and that brings me maybe also to the slogan you have for your day today. As I said, the Bible is the industrial competitiveness. Everything is looked at from this prism. The financial sustainability of the systems and the affordability of medicines, in this case, are secondary to competitiveness. Let's be honest. I'm being very honest with you. And there, when it comes to the health systems per se, we see across Europe an increase in co-payments, in out-of-pocket expenditure. We see some trends of privatization and financialization. And there, that is a question mark also for the future. Will the effect be on inequalities in Europe? So the big message that we as social security institutions have is that we have nothing against strengthening Europe's competitiveness. Who can be against that? We also need good jobs in Europe. We want to have good paying jobs in Europe. We want to have social contributions. Because if we don't have social contributions, how are we going to finance our social protection system? But it should not be to the everything that is happening. You know, the European legislators now are going through with a lot of pieces of legislation, not only in pharmaceuticals, but you know, they are granting to the companies, and of course the companies are using this opportunity to ask for more and more. And we are telling to the legislators, you know, also your parliamentarians who are in Brussels at the European Parliament, yes, we should strengthen the competitiveness, but we should ask for things in return. We should do it in a balanced way. So a more competitive Europe must not become less of a social Europe. This is something for the day also to reflect on. Now, I'm not going to bore you with this. I can only tell you that we are very busy in Brussels. These are extremely important pieces of legislation that are going through. And these are pieces of legislation that have a clear effect on national policy making. So I can assure you that these pieces of legislation are not far away. These pieces of legislation will also cost money here in Slovenia. The asks, I think you already got the gist based on what I'm saying. You know, protect affordability, demand better evidence, but above all, keep social security at the table. Why did Robert Lollo come to Brussels to meet with the commissioner? Because the commissioner had to listen to what Director General Lollo had to say, along with his counterparts from other countries. And this is why Slovenia needs to be in the room. And I'm looking also at Gregor Jagodic. Via the past year, we've been working very well together in building this bridge between Ljubljana and Brussels under the leadership, of course, of Mr. Lollo. Does a collaboration matters? And this is my last slide. Pooling expertise, you know, we can learn from you. For instance, I gave the example of absenteeism. This is a best practice coming from here. This is something that other experts can learn from. Benchmarking, breaking silos. You know, here we focus only on health, but in my job, I have this panorama, and I look at also pensions and other benefits that all of us as Europeans, we still enjoy. Strategy, we need to be strategic, we need to be proactive, we need to be timely, otherwise we're going to have to simply pay the bill at the end, and this is something that we want to avoid. And then, of course, we need to work together, we need to join the forces. Robert, you were in the room with your counterparts from other countries. You know, we need a united front as social health insurances. I mentioned this meeting with the commissioner. This is just an example of what we're doing for a stronger social Europe. We hope, and that's what we aspire to be influential, to be reliable. We want the European policymakers to come to us, to ask for our advice, to ask for our expertise before they draft the legislation. And that's it.